And so with that, over to you.
Thanks. Assalamu alaikum, everybody. Thank you, Professor Skinner. I appreciate that introduction. And also, as you probably know, my book, Professor Skinner wrote the foreword for my book as well. So I think I'm introduced to why I decided to write this book. I think it was being fed up of repeating myself. Because a lot of my students, when I was teaching, and some of them are actually here today, they were saying, well, you know, where is the information? They couldn't find the information in English. There's a lot of information, obviously, in Arabic and Urdu and Farsi, but there was hardly anything in English. So there are some books available, but they are very limited information, almost sort of like pamphlet-like information, and some other academic type information. But there was nothing in the form of a textbook. So that was the impetus for me to write this book. It took about 3 years to write this book. And I didn't write 3 years every single day, but I started writing the book and I gave up, and then I started writing again and I gave up. So because there's so much information, but how do I bring it to a wider English-speaking audience? Because at one point, Arabic was the official language of the world, they say, but now English is the language, international language. So we really need to bring this into more books into English. Surprisingly, over my time of studying this Unani medicine, I met some people who refused to translate books from Urdu or Arabic into English. And which is really ironic, because most of the books that we have were translated from Greek into Arabic, from Arabic into Farsi, Persian, and from Persian into Urdu. And it's a shame there isn't. So that's the impetus to write this book. And so Professor also kind of guided me as well over time, and my students guided me, and also from my clinical practice. And but before I go into the book itself, I wanted to give you a little bit introduction to what Unani medicine is. So I'm going to go through some of the fundamental concepts of Unani medicine and why it's so powerful, and why it's so relevant today, and why I have a busy practice, and has, I mean, interesting thing that Professor said, that it's about the heart. A lot of conditions we see, Professor will probably see, and about the mind. But I was just speaking to somebody just a few minutes before I started to talk, and they said, how did he help me? I feel about 70% better within a few weeks. So I said, I treated your heart. Because a lot of the conditions which appear to be the mind, the Greek studies the mind, but it's actually about the heart. Yeah. And and the heart and the mind are connected. Yeah. So those of you who are psychotherapists or psychologists, etc., that's how I approach it. Yeah. So what that means, obviously these are concepts to some of you might seem alien, and so I'm hoping to sort of explain today, and some of the key concepts, and how we diagnose and how we treat. And obviously there's a lot more in the book, which obviously I couldn't cover in this space of an hour and a half. So there are, in effect, layers. When, as individuals, people think there is the body, but the body itself composes of a number of things. And we have concepts in Unani medicine called elements. Each tradition, whether it's TCM, traditional Chinese medicine, or Ayurveda, or Unani, these are ancient systems of medicines, thousands of years old, have a concept of elements. Not the elements that you you sort of think about, which is elements in the school of the periodic table, has nothing to do with that. These are elements which we call fire, earth, water, and air. These, for Unani medicine, and these concepts help us to link our thoughts on conditions, on the environment, and within us. And we also have something called humours, which we refer to as bodily fluids. So in a modern sense, some people have translated this as carbohydrates, proteins, and that type of thing. But it's much more than that. So these fluids are within our body, which are formed from food, and they have an effect on us. And something else is what the Greeks understood was there's something inside us that keeps us in check, keeps us in balance. And so, for example, let's say when you cut, I said to my students, when you cut your finger, and then you put like a tape or a bandage or something like that, and after a few days, if you remove the bandage, it's healed. Now, is it the tape or the bandage that's healed it, or there's something else? So that something else is what's inside you, your body. So most conditions, on a daily basis, you'll be attacked by bacteria or other viruses, and your body is able to deal with them. It only becomes a problem when it becomes unbearable for the body to handle those situations, whether it's emotional, physical, or metaphysical, and then you need support. And remember, it's support. We're there to support the body. We're not there to fix the body. The body, it fixes itself. It's very important to understand. The one takeaway from today is that it's your body that heals you with the will of the Creator, but it's the body that heals you. The physician's role is supporting. That's all. Whether it's a physician or the psychotherapist or the clinical psychologist, they're there to support you. The body heals. Yeah? So, how do we actually, when a client presents her or himself to a Unani physician, how do they actually, understand the disease? So the most important thing is to understand a disease. So without understanding something, you kind of like, groping in the dark, so to speak. So we have to identify, we have to classify, and there's prognosis and assessment. Okay, but the most important word that I keep telling my students is the asbab, the cause. What's the cause? Why? Without understanding the cause, you can't truly treat your client. And we have 6 causes, six what we call fundamental factors that can make you ill. Yeah, and then that causes an imbalance, and then that causes a disease. So if you, for example, if you fix something, it'll come again because you haven't understood the cause. And obviously, back in the day, we didn't have MRI machines and all that sort of stuff. Yeah. So how did we diagnose? We diagnosed through pulse, by reading your patient's or client's pulse, by observing, if necessary, the stool or the urine, and also patient's history, and by observation. And with time, with number of years of doing this, you understand the client probably 50% as they walk into the clinic, because you've done it so many times. So you understand what's going on by just looking at them. And you use these other tools to reinforce what you understood in the first place. And pulse is like a musical instrument. I would say more like a string instrument. So when we teach post in our course, we say it's like playing the guitar. Yeah, and we can teach you, but it takes time to practice. Yeah, and we observe. So when we observe, when we say we're observing, and students who are in year 3, I'm lucky. I have Aisha Beg. She's here today. She helps the students. As she's a psychotherapist, she helps students to observe. She says, observe and look at the client. Look how the client is sitting, where they put in their hand, how are they talking? Are they talking fast? Are they talking slow? Are they pointing somewhere? Sometimes the client, well, most of the client, points to where the condition is. So that you have to be in a state. I say we go back to Professor Skinner's intro, where he says it's about the heart. The most difficult thing for me to explain to my students is to be a state of rest. And when you're in a state of rest is when you can fully see the client. But people get either they lack. A big issue nowadays is people have lack of focus. They can't focus. So that's why you had YouTube, and then you have TikTok, then you have Instagram, then you have Snapchat. So you can't. The modern individuals, they can't focus for too long. And they get the rush by moving into the next topic. Yeah. So, for example, what's going on in the world now, it's a trauma, and we're all feeling a trauma, but we don't have a chance to actually absorb that or reflect that. Yeah. I was reading a book years ago, I'm talking about 20 years ago, or maybe longer, by a writer called Neil Portman, I think his name, Postman, and he wrote a book, Amusing Yourself to Death. And he was saying the effects of watching TV. I mean, at that point there was no YouTube. The effects of TV. He says you watch TV, and then you're seeing an event on news, and you say, oh, so and so people died, and the next section would be, and now to the weather. And he said that's a big difference between, say, watching a movie. When you went to go to cinema, you watch the film, then you have a dinner and with your friends, and you discuss the film and the effects it has on you. So we don't have a chance to actually reflect and process what's happening to us. So we're all in a state of, probably that's what psychosis, or that's other conditions that psychotherapists will identify. But I say, as a Unani physician, is more than that. Your heart has become sick. Your heart is ill. Yeah, and so there's a famous poet, Allama Iqbal. He says, "Chahte sab hai oje sareeb makim." Everybody wants to reach a higher elevation. Phir paida karo be wo qalb salim, but then create a sound heart. So the heart has to be sound, and whether you're a physician or a psychotherapist or a hijama therapist or husband or wife, you have to be ready to hear the other person. So once we've kind of understood what's going on, hopefully, we don't always every time understand. Sometimes I take a case and then I sit back and try to understand what's going on. You only got that person for an hour, and within an hour you have to try to understand that person's life history. What's going on at home, what types of food are they eating, work stresses, environment stresses, and within the hour you have to open yourself and try to connect with that person. And then sometimes you do what you can, and then when the client leaves, you think, oh, actually, this was going on. Or when they come the next time, you're actually peeling up layers. People are complex. People are very, very complex. But you could be married to somebody for 30 years, you still don't understand them. You don't. It takes time, and I've only got an hour to work somebody out. Yeah. So we have, in terms of treatment, we don't always necessarily give anybody anything. it doesn't necessarily mean that, because the problem is we're used to the fact that we go to a doctor, and the doctor's going to give us a medicine and then we'll get better. It doesn't actually always work like that. I would say probably half is the dietary changes, change in the diet. We have a concept called ilaj bil ghadha, treatment by food. So a lot of people are ill. I would say more than half, I would say, are ill due to poor diet. And it's not just diet saying, oh, okay, you've read on the internet that bananas are good for you, or your doctor said it, or your nutritionist said to you, doctors, the bananas are good for you. Bananas could be awful for some people. Am I right? Yeah. And then who, though? Point is, who would it be not good for? People who will be categorize people into temperaments and humours. So we have 4 temperaments. And so even more simplified, we have, I would say, 2 or 3, 4 properties. So something can be hot, something can be cold, something can be dry, something can be moist. This is all very simple, but believe you me, that's the building blocks to a lot of things. So that combination, we can work out the temperament of an individual, temperament of the environment, temperament of food, etc., etc. Yeah. So meaning, if somebody is hot and dry, they would be prone to hot and dry conditions. Yeah. So here we talk about medicine. There are workshops, things like that. We're talking about personality types. Personality types is a spin-off from this. It's not. This is the real deal. This is about medicine. Okay. So hot and dry individual would be prone to certain types of skin conditions, for example, would have problems sleeping. Why? Because there's heat in them. Yeah. They would like certain types of food. They're attracted to themselves, so they prefer hot and dry types of food, spicy food, for example, which is not good for them. We do treat by opposites. So in other words, they should have less spicy food. Yeah. If they're exercising and they're pumping iron, for example, they're going to get worse because they're really hot. They're doing very strenuous exercises. They're going to be more aggravated. Does that make sense? Yeah. Similarly, sleep and so food and sleep. So bananas would be good for that person because bananas are cold and moist. How do I know they're cold and moist? What does it make you feel? Yeah. What does milk? Milk should be cold, cooling, moisturizing. So that's good for him or her. Yeah. So this is the type of things we're talking about. Yeah. And a lot of this stuff is within, whether you're from the indigenous population or you are from another heritage, this is something that grandma might have told you. Avoid these type of foods. But you thought it was funny at the time. Yeah. But it's serious. It's making you ill. If you understand that. Yeah. So that's what this type of medicine is. And if we have to treat, we use mainly plant-based medicine. It's possible we can use minerals as well, like silagit and other stuff. And there's also things like honey and that type of thing as well. That's possible. Okay? So as I mentioned already, that we treat by diet therapy. It's like a crucial aspect of it. Crucial aspect is diet. People don't want to change their diet, or they say, I have a great diet. Everyone says they have a great diet. They miss breakfast, for example, and they have a great diet. Okay? No offense, but majority of my clients are women, 80% or something, or maybe more, and they usually miss breakfast. They think they're going to lose weight by missing breakfast. That's the worst thing to do. The worst thing to do. Have you heard the English expression, eat like a king for breakfast? Yeah, has everybody heard that? King for breakfast and a prince for lunch. and a proper for the evening meal. We do the opposite. We have our main meal in the evening, and that's one of the reasons why we're sick, because the food doesn't get digested properly at night. It only really, the organs are most active, the digestive organs are most active between 7 a.m. and 11 a.m. So that's the time when you have your main meal. And Unani believes in 2 meals a day, really. But that's just generalizing. Don't we have to. It obviously depends on cases. Some people need more. Yeah. The other thing is we may need to do. Obviously, we do less and less nowadays because of modern Western medicine, where they do surgery. But we still do things like hijama and bloodletting, some type of bloodletting, and other types of massage and saunas and other types. So there's sometimes a physical therapy is what the people need. Yeah. So we either I do it myself or I send him to somebody who can do those type of therapies. And sometimes they need to see a therapist, a psychotherapist. Yeah, and a lot of people in certain cultures think it is a stigma to be told that they have a mental health issue, etc. But it works well because you need sometimes talking therapy alongside, herbal therapy. So don't be shy to see a therapist, psychotherapist, etc. Because sometimes it's good to talk, especially nowadays in this culture, in this country, in the Western countries, because we don't talk to other people. We sort of isolated. We live in our rooms or next to our computer, and that creates loneliness and depression. But in other societies, in traditional societies, the whole village is involved, for good and bad. They know everything about you. Yeah. So it's still, as I said, it's still a relevant and a powerful tradition, and we use it on a daily basis. And as I said earlier, the professor said as earlier, I believe in teaching the next generation of individuals because we want this tradition to sort of expand in this country, because I do believe that in a way we've come back full circle, because a lot of the philosophy is Greek, which is European. And in this society, people like Culpeper, famous physician, I would say Unani because he was Unani physician, Henry VIII's best friend. He died at age 32. He wrote a lot of books, and he took it. He used the 4 temperaments as his tradition. So it's part of the European and British heritage as well. So, in the book itself, we talk about. I cover the foundational theory. Obviously, I will only sort of skim through it this talk, but we give you the foundational theory of what Unani medicine is in terms of elements, temperaments, humours, the concepts, yeah. And then the techniques of how to diagnose, which is pulse. I go into great depths into teaching you how to read the pulse and what you can find in the pulse. Tremendous amount of information, yeah, about the individual, the state they're in now. Yeah. And there's a big topic on the formulations and the herbs and what they do as well, because you'll hear about certain herbs do certain things, and you want to know why, what do they do, what they're for. Yeah, this is so thousands of years. For example, one of the formulas that I still use is called Galen's formula, Jalinus formula. In Arabic, Unani, we call Galen Jalinus because there's no G in Arabic. So they say they add a J instead of a G. So we still use it for digestive issues. Written by the Greek-Roman physician Galen in the 1st century for the emperor Caesar. He had a digestive issue. So you can see how old some of these formulas are. Still effective. And it contains saffron, and cinnamon and cardamom, and they're great for digestive issues, especially when the digestion is what we call quote unquote cold. And what that means is that not just you can be cold, your organs can be cold. Certain organs shouldn't be cold, certain organs should be hot. For example, the brain should be cold and moist, the stomach should be warm. So you need to heat it up, yeah? And these formulations help. Yeah. What else? So as I said, I go through the fundamental concepts, diagnostic tools, Unani wisdom, yeah. So I think I wrote the slides, and then afterwards Professor Skinner called me and said, "Oh, what are you going to cover in the slides?" And I said, "This is what I'm going to cover. Just what I just did now." That's good. That's good. That's good, because he's quite polite. It's very good. Very English, yeah. And but it would be nice to maybe include some, some like type of things that you cover, yeah. So to make Professor Skinner happy, I decided to cover a topic. Oops, it's not on the slides, unfortunately. I don't know. It's not on the one that I sent to the group, unfortunately. I did it afterwards, and so it's not in the actual slides over there. So I'll go through my own handout. Is that okay, everybody? Yeah. So as I said, to make Professor Skinner happy, I'm going to talk about OCD, how we treat OCD, or how we manage OCD, and also didn't want to be too selfish. We said, why about arthritis? So I'm going to talk about arthritis. Also, 2 topics. I'm not going to do autism unless you want to. So I think that's quite a bit to cover, actually. So the first thing is, Unani treats things in terms of temperaments, as you've discovered, hopefully, and we don't necessarily label conditions as such. We would treat things as you guessed it, in terms of hot, cold, wet, and dry, moist and dry, yeah? That's how you're thinking OCD, how's it going to treat it with wet, cold, moist and dry? Okay, you'll find out hopefully, inshallah. Okay. So, as you would concur, the ones who know, that OCD, obsessive compulsive disorder. Has everybody heard of that? Yeah, hopefully. Or know somebody who has OCD, or you think you've got OCD. Okay. So OCD is, in Western medicine, is considered as a neurological condition. Okay. And it's some sort of serotonin imbalance. And you treat it with either CBT, yeah, as a common way. Am I right? Yeah. And maybe some antidepressants. And you focus on managing the symptoms and preventing relapses. Okay. So to that, us is means double Dutch. That does. Yeah. So we see Unani. In Unani medicine, we see OCD as a depressing, repetitive thoughts and actions. Okay. I'll come to it. Bear with me. And it's rooted in something called fikr. Fikr means to overthink something. Yeah, overthinking, and gaman, which is a false assumption. So whenever we see something in life, we make an assumption of something. Yeah, we assume something, and here this person is making a false assumption. Okay, and it's often rooted with something called an imbalance in black bile, which is a cold and dry condition. As I say, so as I mentioned to you earlier about humours and hot and cold, etc. This is a cold, usually a cold and dry condition, and it's a cold and dry imbalance. Okay, but not always. And what's the core cause? Yeah, core cause is, as I said, is fikr. Fikr to a chronic worry. I mean, everybody worries a little bit. We always worry, how do I look, or what's happening, or is the gas cooker on, or is it switched off, or I said to my wife, did I bring my this and that? So that's a natural, yeah. But the issue is chronic worrying, yeah, based on, so basically fear-based worrying, okay? And Gaman is, I said to you earlier, is a false or incorrect conclusion or an imagined danger, right? So there's also a mental tension, and which arises from the dominance, basically something, this tension is dominating your mind, yeah, and can affect both the brain and in our case we say the qalb, the heart, okay? So there are, again, remember I said to you, there are, in this case as well, usually it's black bile or the cold and dry condition. However, it can be all four. Anybody can be affected by it. Any temperament can be affected. Okay, so the classic one is a black bile. In this case, what will you see in them? They'll be doing rituals, yeah. Fear of impurity. They'll always, like for example, they'll come to you. They'll, in my case, examples. I'm sure you can know more examples. They'll do wudu, and they'll say, "Oh, I didn't do it right." They do wudu again, and they become over religious. Yeah, suddenly they become very, very religious. Yeah, and they want to be isolated. They feel they're impure. That's what we call the black bile classical one. There's also the yellow bile person, the cold, the hot and dry person, yeah, which is me. Yeah, I'm hot and dry. Yeah, they have a cleaning obsession. Yeah, they be suspicious of people. They will go to extreme in religions, in religious acts, extreme. Okay. Remember, the other one is just repeating his wudu. This person who becomes like, have you read your 4 salahs? Have you read, no, sorry, 5 salahs. Have you? See, I'm already off the track. Have you read your 5 salahs? Have you done your 4 fard? Have you done your 2 sunnahs? Have you done that? And they'll be on your case, and they think they're not doing right. Yeah. Then the bulgami person, which is a cold and moist individual, they're passive but repetitive, and they will be hoarders. There's a lot of stuff in the attic. They never want to throw things away. They have a foggy brain, or they have anxiety, a lot of anxiety in them as well. The final one, which is the hot and moist rare, they can happen to them. They will be more playful in their repetition, yeah, and they don't always look distressed, but they be hyper vigilant, over alert to environments, and felt they're being observed. Okay, so we've categorized them into these 4 different types, which means that I will treat them differently. I can't treat all of them the same. It's a problem. If I just give them all antidepressants, which is a cold and dry medicine, for most of Western medicine is cold and dry, yeah, it will aggravate them. Certain people make them worse. Some people will help. Right, so that's why, when you have a headache, we say, what type of headache have you got? You say, what, I have a headache? But is it a cold headache? Is it a hot headache? Those of you who have had a hot headache will know what that means. Okay, it's like a fever type. But we treat it differently. Similarly, this complex condition, OCD, is a very complex condition. We have to first identify, the temperament of the individual, and we treat him accordingly. Does that make sense, everybody? Everybody with me so far, yeah? Okay. So, but there are also just behavior traits. How do we categorize them as OCD, and how do we categorize them as just this? That's just him, So, there are probably they say rich people are eccentrics. When somebody is wealthy, they're eccentrics. Because they, if they do these things, they wouldn't be considered to have a condition. It's only the poor people have these conditions, or the middle class people have these conditions. Wealthy people are eccentric. They do weird stuff, and they're eccentrics. Yeah. So if somebody could be a perfectionist. So a black bile person is a perfectionist by nature. So they like to, so they will do it. So I know who, when people hand their assignments in to me, who the black belt person is. They write things in detail. They go on and on and on. Right? So do the phlegmatic types to some extent, but they're just very meticulous. If they don't get 99.9% pass mark, they're stressed out. Yeah. So, but then we have to categorize the normal traits to a condition. Does that make sense? Then how do we treat them? We treat them based on their temperament. In this case, OCD, we strengthen the brain, we strengthen the heart. Yeah. So, example, we would give something. We have formulations we call majuns. Majuns are formulations where we powder the herbs and we put them into honey. Why? Honey is a good vehicle because we can put more of the stuff in there. If you put them in a capsule or a tablet form, we can't put enough of the dose we want to give people. So majuns are a good way of giving people more of a bigger dose. Yeah, and it's almost more palatable as well. Some of the herbs are bitter, really bitter. So the vehicle of the honey, and honey itself has fantastic properties. It also healing properties. Yeah. I think we had our exams yesterday. The students had their year 1, 2, and 3 exams. And one student messaged me saying, in the group saying that, oh, I have hiccups. I just have hiccups. What do I do? I have hiccups. And so I said, honey and cinnamon. Honey and cinnamon. So honey is a vehicle and cinnamon, because this for us is its intestines have become dry due to stress. Yeah. So we give them honey to lubricate them. Yeah. So once you understand the concepts, it'll become easier for you. It's just so we teach. We need to drill in, or remember what Grandma used to say: the concepts. Once you get the concepts, then it's a piece of cake. Okay. So we give something like a majun najah. Najah means in Arabic freedom. You free from this condition, I suppose. Yeah. These people, when they wrote the formulations, they either write it due to what it did, or their own names, or the town they were from, etc., etc. Yeah. So majun najah is a very good formula. We give dual misk. Dual misk contains a few herbs in there, which actually, when you take these medicines, it smells in a certain way as well. So smell has a big part to it as well, and a taste. So you feel like, somebody said to me, she said, I feel like the Queen. I feel happy and elevated. So that's also part of it. And we give, like, sometimes people can't take these things, so we have to give them in a syrup form, like Sharbat Unab. Unab is, as I keep spelling, it's called Chinese date. It looks like Chinese date. Yeah. And it's very good. Brahmi is a formulation from the Ayurveda in Indians, system medicine. Very good for the brain, feeds the brain. I gave that to my daughter when she was doing an exam. She's here today. And so she said, oh, it really helps me. Just before I'm revising, it really helps me think better. Brahmi. Or Khamira Marid. Marid is made from pearls. So we powder the pearl shell, powder it, and then we mix it into a sugar base. That's really very, very effective. Okay. So in summary, OCD is a multi-dimensional, temperament-based, emotional through the spirit, and once we diagnose a person, we give the right formulations. Okay? I know we're covering a lot. It's a lot of information to give, but hopefully it'll be useful. Shall we do arthritis? Anybody wants arthritis? Anybody? Yeah? Yeah, we got a bit of time. Yeah, we got time. Okay. So we'll do another condition, arthritis. Hopefully those of you, a lot of people want to study, psychotherapy, and my daughter studies psychotherapy. My wife's a psychotherapist. So I'm surrounded by them. So that was for you guys, okay? OCD. But a lot of people suffer from physical conditions like arthritis. Mom has arthritis. Dad has arthritis. Uncle has arthritis. I have arthritis. Not me. I'm just saying, over there. I don't know, alhamdulillah. So again, we actually, so what's the current modern view of arthritis? Does anybody know what the Western view of arthritis is? I know we have GP in the room as well, but anybody know what anybody's heard of? Okay. Yes, thank you. It's autoimmune disorder. Okay. All right. Anybody else want to know? Sorry, inflammation. Oh, yeah. So they in the modern Western medicine they say arthritis is divided into types of RA with the rheumatoid arthritis, okay, which is an autoimmune condition. It's osteoarthritis OA, which is a degenerative condition. Then there is gout. Sometimes that comes into the category. Yeah, gout. And how is it managed? How do they manage it? They manage it by either non-steroids, on anti-inflammatory drugs, or they use steroids, or they use disease-modifying rheumatic drugs, or joint replacements, etc. That's how it's managed. All right. In the Unani sense of the word of this, how we would approach is a totally different way of seeing things. Completely, you think, oh, but we treat this in this way. So we would say it's an inflammatory type. One of the ways with inflammatory type, as they say in Western medicine. So it's dominated. This person is dominated by heat or sufra or dam. Those are those conditions. Yeah, hot and dry or hot and moist. There's heat involved. There's swelling involved. And then there is the joints could be red. They could be acute. It could be burning pain. Okay, it may include a fever, thirst. This person will be more thirsty. So how do we treat it? How do we focus on this? We'll be focused by cooling in the system. We're looking for cooling. Yeah, and to basically reduce inflammation. And we would use something like sharbat or nab, I mentioned earlier, Chinese date, and we would use another formula called Itrif Zamani. We would use Arq Macau as well. And these what they do is essentially they will be a cooling action. Yeah. And we also may do some hijama or bloodletting in this case. Okay. It could be what we call Mada based. In this, remember we talked about 4 temperaments, but we also talk about corrupted matter, which can get stuck in those joints. Yeah, this matter which is corrupted, can cause an issue, and this is usually people who are cold and moist, or cold and dry. These people tend to suffer these type of conditions, and that's what the condition is for them. Okay. They will for them they will say there's a heaviness, there's a dullness, there is stiffness, and then they always say it gets cold. It gets worse when it's cold. Yeah, or when it's damp, and then you treat. That's your clue to how to treat them in this way. Yeah, differently. Sorry. So in this case, we're looking to resolve the matter, remove the matter from that joint or whatever it is. Okay, and again we have a number of things. We use a formula. You can maybe make it home. Even we use rose petals. Yeah. I'm probably going to put some people out of business, but you can use rose petals. All people think, please take them. My nephew's a doctor, and he says, please take them. He's they're drowning. The modern Western NHS is drowning. They need help in a way. That's how I see it. And so rose petals. If you powder rose petals, if you can get powder rose petals, you use them, and you take them into a powder form. You take a teaspoon with water, and you'll see a benefit in that, inshallah. And but there are other, you can massage them with warm oils, like black seed oil. Yeah, it's very good, or olive oil. And then obviously we use more stronger formulations if needed, if they come to see us. Yeah. Um, then the other one, which is a bit more tricky, is when there's a degeneration. Yeah. When there's a degeneration, what we call osteoarthritis. Yeah. So this is more related to what we would say dryness, an atrophy, often related to it could be a black bile in this case. So there's a wear and tear of the joints. Yeah. Bone deformity, stiffness without swelling, worse with activity, yeah, and it's usually age-related. Here we look to nourish those joints, moisturize them, and strengthen the joints, and we give a formula called Margin Falsafa, Dual Misk. You can also something you'd be surprised is boil fennel water. Just boil fennel, a teaspoon of fennel in a glass of water, a glass and a half of water, boil them, simmer it down up to about a glass or so, and then drink that. Calcium-rich diet would also really help. So as I said, not all arthritis is the same. We treat them differently, okay? And so finally, the logic of Unani medicine, it's again, as I said to you, is hot and dry, cold, hot and cold, moist and dry, and we decide based on the Mizaj of the individual. And yeah, and then if you want to know more, buy the book. Right. Thank you, everybody.
Well, thank you.
Okay. Oops.
Well, brilliant.
Thank you.
Always learn.
Thank you.
Closest I've been to you.
Thank you.
So I think we're all very grateful. The floor is open for questions. If I could just start, we know we have a government that's intent on destroying the British meat industry, and it's encouraging, through people to eat, in effect, artificially made meat. I've noticed as a psychologist that people on particularly vegan diets, sometimes vegetarian diets, bearing in mind the climate in which we live in this country, often also present with psychological disorders. And I wonder if you could say something about these diets in relation to temperament and the climate that we live in, and whether they have an effect on what are sometimes almost epidemic problems that we're seeing now which we weren't seeing 20 years ago.
Yeah, sure. I think that's sort of probably a wider question about diet. So diet, as I said to you earlier, is a key factor in illnesses, eating the wrong foods at the wrong time. So we eat, I think years ago, maybe more than 30 years ago, I was speaking to my grandmother, and I said, I told her that in England we could get pomegranate in the summer. She couldn't believe it. She said, that's not true. It's not possible. I said, no, Grandma, you can get pomegranate in the summer. She said, how is that possible? So she just couldn't in her mind work that out. Okay, so we're eating food which is out of season, which is harmful to us. We need to eat food, and the indigenous population understood that. They ate foods with in season. Okay, so that's the first problem that we're having, eating the. Then the other issue is eating the wrong types of food for ourselves. So in a colder climate, we can eat more meat, generally speaking, and in a warmer climate, we should be eating less meat. So the reason is we can digest meat better in a colder environment. And we should really kind of try to stick to the diet that your ancestors ate. They kind of obviously worked it over time. The problem I have is overconsumption of meat, eating too much meat. So I have people eating meat every single day. So they say, well, how much meat should I be eating then? So I've sort of devised a trick. This is my own trick. I said, well, how many teeth should we have? They said 32. I said, how many of these do you have? The canines, how many of those? They said 4. I said, divide 4 by 32 is 8. So once a week, meat's enough for you. That's my own simple way of trying to explain to people how much meat. The problem is we eat far too much meat. So, and the other thing about meat is that some of my uncles who passed away, a long time ago, and they were very strong and healthy, and they were proud to be in the British Army and that sort of stuff in the Second World War, sorry. And I said, well, what did you guys eat? Because I want to tell my clients this type of food, because they were very healthy and very strong. They said, we were starving. When we were growing up, we had hardly any food. We would eat very limited amount of food. The problem is now is the overconsumption is our problem. And eating the wrong types of food. And then when we talk about meat, it will take an hour to talk about meat. Because meat, what type of meat are you eating? Yeah. So for example, beef is cold and dry. And if your temperament is cold and dry, it's going to make you worse. Lamb is warm and moist. And if you're, generally speaking, it's a better meat. Lamb. Yeah. And so that's what I'm saying. So there's a wider discussion. There's types of meat and there's types of milk, and there's, cow's milk is cold and moist, and goat's milk is warm and moist. So that type of thing. So it's a wider group.
Vegan diet?
Vegan diet, we don't have that concept really in Unani medicine really. Or none of the traditions, whether it's Chinese, Indians, or us, we have a concept of raw vegetables. We do not believe in raw vegetables. So vegetables have to be wilted, or at least wilted. Chinese won't eat it without wilted the vegetable, for example. So because anything that otherwise if you're not wilting the vegetable, the stomach has to do the work. Yeah. So that's when some people have difficulty digesting certain vegetables like cauliflower and those type of things. That's the reason.
Thank you very much. Well, the floor is open.
Wa alaikum salam. Thank you.
I'm a GP actually, and I really believe in all of this. Some clinics, I don't give a single prescription, and I talk about lifestyle and individualized health. It's really something that I'm interested in. So lifestyle medicine is what we're calling it these days.
Yeah, okay.
I've got 2 questions for you. One is a personal question to you specifically. Do you practice what you preach? So actually, you go on the internet, you go around town, there's Holland and Barrett amongst many other places, and then I think people have jumped on the bandwagon with faith, so, blessed this, son of that, and you can get honey, and you can get this supplement, and you can get that supplement. So in your life, every day, what concoction do you take and why do you take it? So do you take it for health span, longevity? Do you take it to balance the temperaments? So that's the first question. The second question I've got is, next week I'll be giving a talk at St. Christopher's Hospice around the concept of pain. And David Cicely Saunders said that towards the end of life, pain becomes quite a all-encompassing and complex thing. So you could have a physical pain, but towards the end of life you may have a existential crisis. So you might worry about climate change or the war in Gaza, and on your deathbed that is your pain. So we have to think about all of that in terms of a holistic approach. I just wonder whether the Unani medicine field has a concept similar to that in terms of pain, and how do we deal with pain, particularly towards the end of life.
Okay, quite a bit of stuff in there going on there. Okay, so I'm going to sort of break down and do what I can. So first of all, you talked about the lifestyle factors, yeah, and it actually comes from, I believe, in our tradition, which is the Asbab Sitta Zura, 6 lifestyle factors, 6 factors that can. Basically, what we believe is that you should remain healthy unless the 6 factors affect you, and these are sleep is one of them. In other words, sleeping too little, too much, diet, eating too much foods or eating the wrong types of food, eat little food, and then retention, evacuation. So in other words, if you either sweat too much or sweat little, or you defecate too much or too little, and then there is rest and exercise. If you're just sitting and not exercising, have I missed anything? Yeah. So those are the 6 factors that we have, and we believe those. We're neither calling them lifestyle factors, but it's from Ibn Sina and our traditions. Yeah. So that was the first one. Then you were asking about, would I be using or that type of thing to keep myself. What I would be using wouldn't be the same as what you'd be using. That's the thing. So already I have an idea what type of person you are, what type of temperament you are, would not be necessarily appropriate for you. It will just aggravate you because it will make you sleep less. Okay, it will make you overthink. So, for example, I occasionally would take Silajit, occasionally, not all the time, but mainly it's diet control, eating the right type of food and not eating too much. That's the main thing. Yeah, but Silajit is very good because the modern society is suffering a lot from nervous system conditions, and the Silajit it helps. But so Silajit is it comes from the Sanskrit, which means that to conquer rocks. So thousands of years ago, in India they found that these monkeys were licking the areas from this mountain terrain area in the Himalayas, and they would start being agitated, and they found out what was that. So they took that and it's like a tar substance, and what's happened is over thousands of years, the growth that was going on the rocks, it would go inside and they would eventually ooze out. It looks like tar, it tastes like tar, right? But most of you, I wouldn't recommend it because it's actually, unless you're old like me, generally speaking, and it'd be good for you as well. Oh, you're good. Okay, so young people, no, I wouldn't recommend it to you because you'll have problems sleeping and that type of thing. Yeah, so that's why if I tell you what I do, maybe then people say, oh yeah, he's doing it, I'm going to do it now. So no. So it has to be most people. Like I had a student once, and I said, look, ashwagandha is not good for hot and dry people, especially menstruating women. Should not take ashwagandha. And she, obviously, so she was my second year student, and then one day she came to me and she said to me, Hakeem, my cycle stopped. And I said, how long has it been? She said, it's been 2 months. What do I do and what's going on? So I said, is something you're eating to change your diet? She said, no, I'm eating the same. I've got a fantastic diet, apparently, and this and that. And I said, no, listen, there's something you're not doing. So anyway, so I gave her something to start the cycle. Cycle started. Then she realized, she says, oh, Hakeem, my mood dropped in December because it's winter, and then I decided to take ashwagandha, and my mood got better, but then my cycle stopped. Right? So I said, you should know better than others that it's because it's a hot and a dry herb. You're already a hot and dry person, you'll feel worse. You go on TikTok and Instagram, they'll say buy ashwagandha because they want to sell you product. But trust me, it'll make you worse in most cases. Yeah. So it's very dangerous to just go and pick up stuff from the Instagram. And pain. So the pain issue, the thing is, we have 15 types of pain in Unani medicine. Okay, is it adult pain? Is it itchy pain? Is it a stabbing pain? Right, and then we treat it accordingly. I don't know anything about the last time when when you're dying or towards the end, what that means, the significance of that. That I'm not aware of. But we do have pains and we treat them differently. I hope that's answered your question.
I've got a question on temperament. So initially when you started, you mentioned how certain temperaments they have preferences.
Yes.
So when it comes to like the choleric, they obviously tend to go for more weight training resistant.
Yes.
How would you advise a female choleric to, what kind of, rather than sending a female choleric who prefers to do weight training, she's not going to go and walk into a yoga center, for example. So what would you recommend for?
Yeah, it's a good question. Okay, so that's actually, there's 2 parts to that. I'm going to give you some additional information which I didn't give earlier, is that women's temperament is slightly different to men's temperament. Okay, women are a degree colder than men. Okay, so that's what attracts men towards women. So we gravitate towards women because of the temperament of women are slightly cooler. Okay, because men generally tend to be hot. Okay, so that's the first thing. Second thing is, in terms of exercise for somebody who is hot and dry, there's there are swimming, for example. Swimming it will help you. Walking, jogging. There's other or if you do go to the gym, you don't have to necessarily pick up very heavy weights. You could do lighter weights more often. That's that type of thing. Yeah, has that helped? Any other questions?
In terms of like the hot and cold and first of all, like how do you, I guess, know like what a person is, or is there a way of like a person being able to know what temperament they have?
Yeah. Yes. Okay, that's a very good question. Every event I go to, people ask me the same question. Okay, how do you? First of all, and there are lots of courses and workshops, and they talk about personality types. The most important thing that I need to tell you is that you cannot work your own temperament. It's very hard to work your own temperament. You can do it, it's very hard. It's always somebody else can help you identify your temperament. That's the first thing. Okay, and there are certain clues on how to identify your temperament. As I say, in my book I talk about that. Not plugging the book, I'm just saying, but that's what it's talking about is today. But you can go onto my website for free. It doesn't cost you anything, and you answer some questions, and it will tell you your temperament. Okay, does that help you? Anything free is good.
Thank you. I was just wondering about, you were speaking about the breakfast, the 2 meals a day, the digestive organs being most active in the morning. And I was just wondering about people that come and, they say, oh, I can't eat breakfast in the morning, I don't feel hungry. Is it, for you, is it across the board that we should be having that bigger meal in the morning? Or if someone doesn't feel like that, then is that something to be corrected, would you say?
Yes, sure. Yes, very good question. A lot of people don't like to have breakfast in the morning, or for various reasons. Either they have to go to work and they have to rush, or they have to take the kids to school, or whatever reason is that they just cannot eat breakfast in the morning. You've got between 7 and 11. It's quite a big span for you to eat something. So you might not be, I'm not saying, let's say you get up at 7 or 8 o'clock and say, I got my, full English or something. I'm not suggesting that. What I'm saying is between that time period is when the digestive system is the most strong and effective to digest food. And I'm not talking about you don't have to have a huge meal. First of all, I'm not suggesting that people eat too much either. The problem I have is that people are eating too much. I was looking at some of my books, which are like older books, 100-year-old, 200 years. They say, please tell the client to have at least 1 meal a day. Because the problem over centuries, it was the opposite. People didn't have enough food. Yeah. So most of the formulations that we have are there to increase weight. I would say there's only 2 formulations out of thousands of formulations that actually help you to reduce weight. And there's no real effective medicines in Unani or other classical tradition to lose weight. There's loads of formulas to increase weight. You understand there's a reason for that, but people, were not eating that well back for a long time. Yeah. So yes, eat something, but my point is the main meal should be in the morning, and less in the evening, more in the morning.
Yeah, I'd just like to know how much success have you had with treating psychological conditions such as OCD, anxiety, depression, which can be chronic, at the risk of you kind of maybe not selling your book? Is the answer more nuanced? Maybe it's more complicated to treat those conditions?
It's complex conditions, yeah, definitely. Also...
have you had?
have a very good success, alhamdulillah. in anxiety, depression, and those type of conditions. You have definitely had very good success. There's even people in the room today who I've treated, and obviously can't discuss who they are, but definitely. But I don't want you to take this away from this that it's just that they only have to come and see me. I need the support of psychotherapists or etc. because it's a combined effort in traditional societies and people they accepted that talking therapy and other types of therapy are needed. So no, it works hand in hand. So as Professor saying earlier, that he sometimes sends people to me and I do vice versa. And a lot of people I send to my wife Fatma, I send them to her because they need help. It's a combination, and it's not just me. They can go to the GP. They sometimes they have to go to the GP. And in fact, most people that come to me say, "Have you seen your doctor?" But that's your primary carer, because people. So, for example, somebody may say, "Oh, I'm chronic. I'm fatigued. I'm always tired. And I say, "Well, have you seen your GP?" "No, I don't want to see him or her, whatever." I says, "No, you have to see your GP because it could be thyroid, it could be iron deficiency." So we're not suggesting in this talk, or I'm not suggesting that, that they only come and see me. I would say I am one of the people that can help you, but sometimes with the support of other people. Yeah, does that help to answer your question? Okay, that's fine.
Just for examples, I don't mention at the beginning, but somebody can be depressed because of events that happened in childhood that have made them feel bad about themselves.
Yeah.
Now that's a psychological issue,
Yes.
which we would treat psychologically.
Exactly.
But they may be melancholic by disposition, so we can, with the help of the Hakim, relieve the intensity of the symptoms.
Yeah.
But there are also things, it's very sort of advanced, but we've sent people to Hakim for this, that to help people open up.
Yeah.
Because the disposition
Yes.
can be sort of too tight.
Absolutely.
So the combination is very fertile.
Yes.
And ideally, we'd be, like a Ghazali or Renaissance man, we'd be trained in everything.
Yes.
But we're not.
We're not.
So it's knowing that we work as a team and that the Islamic psychology gels at this was the same principles as Unani-Tibb.
Yes.
And working in conjugation produces very much better results.
And for me, the frustration is that I want them to see a psychotherapist, for example. I know they need to see a therapist, but they don't want to go to the therapist. That's my problem. And it's the case, and I said to my wife, Fatma, look, this person needs to see you, but they won't go, right? So I could say I'm like I would say I'm like a bad therapist, or not a bad therapist, but like a weak therapist, because I'm not a therapist really, So I'm trying to do the job of somebody else, and it's like say Professor or Fatma or Aisha Beg, or they say, I'm going to give them herbs. That wouldn't be right, because I'm a specialist in my field. So I try to encourage them. They won't go, and even vice versa. Fatma says to me many times, my wife Fatma, she's a psychotherapist. She will say, "Oh, they need to see you, but they won't."
So it's a question about honey. So
I
just have some basic knowledge from Ayurveda about honey, which I understand from Ayurveda increases its nature of fire. So sometimes can be problematic if you give it to people who are choleric.
Yes.
And also, Ayurveda, from my understanding, cooking honey is something that they would absolutely not do because it's like fire on fire and it turns it into a toxin. But I notice in the West people tend to use honey as some sort of sugar substitute if they're baking, things like that, and cook with it, but that, from an Ayurvedic perspective anyway, produces like quite a lot of toxicity. So I'm just wondering whether you have a perspective from Unani.
It's a good question. So we use, as I said earlier, we use honey as a vehicle to put in so it's specifically to the Unani. I'm not sure if the Ayurveda people, definitely the Chinese, they don't use so much honey as what we do. We use honey as our main thing, component, or we use in a lot of formulations. So honey, but we don't give it to people who are hot and dry, like myself. So for me, taking a hot and dry prescription, which contains honey, might aggravate me because I'm already a hot and dry person. However, to mitigate that or to balance that, I would probably be putting some cooling herbs in there to balance the heat of the honey. So we take that into account. If we have to give it in honey, we might give it in a different form. And we don't. So we would warm the honey slightly, very, very just slightly, so that the herbs can then blend in there. But we are aware that there can be potential issues. And honey, for us, honey is like a big thing. Honey and milk are the two big things for us. We use a lot of honey and milk, right? However, milk, so the opposite of honey, so milk would be problematic for phlegmatic types. They will suffer from a lot of issues. Yeah. So, but this is general. Obviously, in this talk, it's just a general thing. But when we prepare the formulation, we're aware of the temperament of the person. We're aware of the temperament of the formulation, the single herbs, and that type of thing, and the carrier. Honey is not just a carrier; it does a lot more things. Yeah. And as you know, honey is useful for many, many things. Most of you are probably aware of. I think when my daughter, when she was very small, my wife made a cup of tea, and then she was maybe a few months old, and then she just grabbed that cup, and it fell all on top of in front of her. And we quickly put some honey on there before she went into the hospital, and then it cleared very quickly. Yeah. Oh.
Hi, I just wanted to ask how you approach more sort of life-threatening illnesses, such as perhaps some students have like strokes or repeat strokes. Is there a different way that you'd approach something like that, where there's perhaps been some sort of paralysis or anything like that?
So you're saying about strokes? Yeah. So what about strokes? Sorry, I didn't understand.
Just how you approach sort of life. So a lot of the illnesses that you've discussed are perhaps like conditions that people can live with. But within Unani medicine, is there a different approach perhaps with more life-threatening illnesses such as stroke?
Yeah. So obviously preventative. It's before people can reach that stage of strokes, and once they do have a stroke, yes, we can manage them very well. But most people don't come to us, when they had a stroke. But even if they come to us within a short period of time, I'm talking about a few weeks or 6 weeks or so, we can definitely help them, for sure. And not just us, Unani and Chinese treat it very well. So Chinese, for example, I also train in Chinese medicine, Chinese acupuncture. They, for example, if somebody's just had a stroke, for example, or very recently, they'd look for a spot in the mouth, in the gums, and they will bleed that part the recovery of stroke is very good. The Western herbalists also, they do very, very well by giving things like cayenne pepper or things like that. Cayenne pepper is very effective, and even if you don't have cayenne pepper, if somebody's having a stroke, they would suggest Western herbalists. In Unani, we have loads of stuff for that as well. It's not just us. A lot of traditions deal with those type of conditions.
I've just got a quick question. As a psychotherapist, I actually find clients get stuck, and sometimes I need to create movement for them. Are there any herbs or anything generic that we can give them to help create that movement?
Is your favorite Giloy? So it depends. I mean, Aisha's also asked me this question before, and there are a number of herbs we give. So as she was saying, that sometimes clients get stuck and they don't move, stuck in the pattern. You were saying that earlier as well. So sometimes herbs can help, and and it depends on the case basis, but something that can help with the flow and movement, and that would be something like Giloy. A herb called Giloy is very effective for that. But also Qigong. This is not from our tradition; it's from the Chinese tradition. very effective. So something like qigong is very effective. So a lot of times I tell my clients to do qigong for the liver or other organs, and they surprisingly they find it very effective.
What is qigong?
Also, qigong, have you heard of tai chi?
Oh, yes.
Yeah, it's like tai chi, but it's similar to tai chi, but it's called qigong. You can just YouTube it or something, and it's very effective. So you go in there and say, you know, they even said something qigong for stuckness, you know, or qigong for the liver, qigong for the lungs, and it looks like some people laugh. Oh, what's this? I'm just moving my arms, doesn't do anything. The worst exercise you're giving me, right? And I says, well, just keep with it, right? And because the people paid 50 quid, I don't know, what's the point of this, right? And so, you know, if they do that, it does help. So I would suggest everybody have a go at qigong. For all of you need it. All of you are actually very, very stuck. These whole people in this room are stuck. So I would say search for qigong for liver and lungs, and you'll thank me afterwards and send me an email saying it didn't work. Yeah.
First of all, for sharing your knowledge and
Thank you.
experience and time with us. I wanted to zoom in on a particular topic of fats and oils.
Sure.
Fats and oils, like.
Okay. Yeah, sure. Yeah, thank you. Yeah.
Going debate about saturated being good and then not being good, polyunsaturated being good, not being good. And just to give context, I'm very familiar with Unani, and very grateful to be here. I just want to share briefly how I make sense of it logically. Like fats are often, or oils, subject to oxidation, and the saturated ones tend to oxidize less, especially in warm circumstances, given that we as human beings are warm-blooded animals. They tend to lean more towards saturated, and also knowing our ancestors were very good with butter and lard. But also on the last thing, which is like if you look at nature, then there's usually a bit of a wisdom, like fish that usually are cold-blooded and swim in cold waters. They have unsaturated fats, but we tend to now take them as healthy fish oils. So I wonder if in Unani there is some sort of guidance and wisdom what type of fats are most suitable for human beings. Are they more unsaturated, polyunsaturated, and what is the logic or the reason in Unani medicine?
Okay, thank you. Yeah, very good question, and I think we'll probably have room for after this one more question. I think that's it really because of time factors. We got 5 minutes, so so it's a very good question, and people ask me this all the time. Okay, so I know it sounds like a broken record. Back to temperaments. Yeah, what's the temperament of the oil? So olive oil is hot and dry, for example, hot and dry. And it's very suitable for Mediterranean type of people, Italians and Spaniards and, you know, North Africans and you know, Turks and that type of thing. Yeah, but not necessarily suitable for the subcontinent people. Why? What's special about subcontinent? It's very hot and dry. So if you're eating a hot and dry, oil is hot and dry. And then you got spicy food anyway. By the way, that's a given, and then it's not necessarily suitable for. So as I say, it depends on the region you're from, your temperament. So over there they have ghee, right? They have ghee. Why ghee? Because ghee is lubricating. They need lubrication, right? And so when we used to go and visit, you know, Pakistan, out in the village, and that type of thing, and we see these old timers, and they would have their food, and they would rub the ghee on their arm. They thought it was disgusting, right? And they thought, you know, we're civilized, and these people are doing this stupid ghee thing, right? But the point is, the ghee was helping their joint pains, right? So ghee for us is an amazing product. So we tend to use it. The problem is, in this country, having ghee, too much ghee can be harmful. Why? I'm hoping somebody will know this by now after 1.5 hours of talk. It's a cold and damp environment. Northwest in particular. We're still in Northwest? Yeah. So Northwest, it's a damp, cold. That's why some of your parents and grandparents came here, because they want to work in the mills. The mills were they have cotton, and the cotton wouldn't break in the Northwest. That's why they had my father-in-law said when he came there was 100 mills around where he worked in Oldham and Manchester area, and go from one mill to the other and get the job, when he could just get a job, wherever he wanted to. So, but in this environment, too much ghee won't be so good for you, but a small amount would be helpful. But and olive oil is very good, but cooking olive oil, problematic, because heating can have an effect on it. Maybe in salads and that type of thing, very good. Olives on their own in itself, it's good. So yeah, so it depends. So, but most of the oils that you're consuming, they're very bad for you. Then we don't know how they're making them, how they're producing them. Corn oil in particular, it's very bad for you. Is that okay? Yeah.
Add more fats, butter, lard.
Fine. It's. I mean, don't sort of hang me or something. But it's the people who've lived here for 10,000 years, they've worked it out somehow, haven't they? So they do have lard, they do have fat, they do have. But the problem is the overconsumption is in small portions. Obviously, if you have a heart condition or you have a problem, won't suggest that. But generally speaking, if you're healthy, yes, it has actually benefits, because a lot of issues are when people, some women that come to see me, they can't have babies because they exercise like mental twice a day. They look like they're really thin like rakes, and they don't eat anything. So we get them. I suggest ghee. They say, "Well, we got fat." Well, they say you need to be a little bit fat to have a baby. Yeah, is that okay? I think we've got time is up. Thank you, everybody. Thank you for coming. And if you want to learn more, you can contact me in my clinic or come on my courses. And Professor.
Website. And thank you very much for a brilliant presentation.
Thank you for having me.
Again, really grateful for having known you and grateful for your help.
I'm grateful for being here.
Clinic we have. The Hakim's books will be on sale outside, and you're signing them?
Yes.
This is a book signing outside. So thank you again.
Thank you very much. Thank you for having me, everybody. Thank you. Thanks. Assalamu alaikum.